I call the honourable member for Capricornia.
Thank you, Madam Speaker. My question is to the Minister for Health. I refer the Minister to the Mackay GP Super Clinic in my electorate that was promised more than 3 years ago. It is still not open and has yet to see a single patient. Will the Minister update the House on how the delays to the Mackay GP Super Clinic have affected the provision of health services in my electorate?
I call the honourable member for Minister for Health.
Thank you very much, Madam Speaker, and thank you very much to Member for Capricornia, who's a great local advocate for people who need health services. When we came into government, we knew that Labor hailed the GP Super Clinic program as one of their great successes in health. And I thought, well, I should look for some examples. I should look to see the great successes of the former Health Minister, the member for Sydney. And I was speaking to the member for Capricornia, and she happened to mention this particular instance, and I thought, well, we should get some detail. And do you know, to her credit, the former Health Minister announced this GP Super Clinic on the 10th of August 2010. It was a $7 million commitment of taxpayers' money to this GP so-called Super Clinic. But the problem was, it took 643 days for the former government to put pen to paper to sign the actual funding agreement. Now, the former Health Minister says that this program drove her crazy, even though it was one of her greatest achievements. And do you know that today, here we are in 2014, and we know that there has been not a patient seen because there's no building. I mean, there's no rooms for the doctors to practice in. It is a virtual clinic, as Labor would have it. Now, the Labor government wasted billions and billions of dollars. And do you know that at a time when the Medicare levy only raises $10 billion, yet the Commonwealth spends $62 billion on health? Do you know at a time when medical services 10 years ago cost us $8.1 billion, and yet today, having gone up by 124%, costing us $18 billion a year, and we know that Alzheimer's, for argument's sake, has gone up by 170%, Labor still decided to waste billions of dollars on these stupid programs when they should have been spending it on patients and the sorts of services that delivered outcomes for Australian people who deserve elective surgery, who deserve the sorts of services that they couldn't get under Labor. Now, there are many, many examples of the way in which Labor wasted money. We were elected to clean up Labor's mess. We will do it in health, and I will make sure that this government gets money back into frontline health services so that we can help the ageing of our population meet the health needs that they have in the 21st century. I will make sure that we clean up the billion-dollar mess that Labor blew on e-health. I will make sure that we clean up this super clinic program, because I want to make sure that we get the health needs right for the Australian people in the 21st century.